Then we have other healthcare companies which also comes into an healthcare, that is an health insurance. Why health insurance comes into a healthcare? It might be health insurance is not that important in Indian scenario, but it has a lot of importance in an abroad or US scenario where it is mostly funded by the insurance company. In India, all the expenses are carried by the out-of-pocket expenses, but in abroad, it is taken care by the health insurance companies. So that's why it becomes a pillar of healthcare, where there is an health insurance penetration is more. The people are willing to pay for the health, or people are willing to pay for the medical treatment. If the people don't have an security or risk coverage from the health insurance, it might be the spending on the health is less. Then we have TPA, basically belongs, the full form of TPA is third party administrator. Third party administrator basically is the industry which plays a role between an health insurance and the healthcare providers. They basically process the medical claims, they settle the medical claims, and they keep the record of the medical claim settlement. Then we do have a healthcare NGO. Why healthcare NGO is a pillar of healthcare? Like lot of, when we go up again in the advanced stage, we'll see that it is further divided into two parts, where there would be a public and the private. When it comes to a public spending or public healthcare, then we need to educate the people. We need to train them about the physical education, about the sanitation, and this has to be done by going in the community, and all this is done by the healthcare NGO. Then we have a healthcare BPO or KPO, which is also a pillar of a healthcare. It is actually the healthcare BPO or KPO is where we are providing an access, or we are giving an services to the US health insurance company. And then we have a health information technology, which is again a very important part in the healthcare nowadays, because all the hospital is transforming, all the hospital is having an software, and all the data captured is stored. So all hospitals have an hospital information system software. This hospital information system software, or HIS, is basically designed by health information technology companies, which is known and which is also helping in the business intelligence processing and the decision making of the hospital management. So these are the basically three pillars of the healthcare. One is a hospital care, where it directly comes the giving a medical and the nursing services to the patient. Then we have a linked healthcare companies, which is a bit linked to the hospitals, like medical pharmacy, medical equipment, and clinical research organization. And then we have some back-end companies which are not directly linked to the hospital, but they also plays an important role in giving and services in the healthcare. So these are the three pillars of the healthcare. Now we will see how the healthcare is classified. Basically, this healthcare is classified into two categories. One is a public health services and second is a private health services. When we say public health services, basically it is for a community. If you recall the definition of healthcare, we said it is for the individual and community. When we say community, it belongs to a public health services, and when we say for an individual, for specific patient, it belongs to private health services. So what are the things which would be covered under the public health services? First is control of communicable diseases. Communicable diseases which are spreading, or which are spreading in the community. It can be leprosy, it can be tuberculosis, which if not prevented will have a major stroke. Major of the public would be affected from it. So that would be control of communicable diseases will come under the public health services. Like we have a TB eradication program, leprosy, sanitation, like proper sanitation. If not proper sanitation, it will have the adverse effects and the people will get affected. Maternal and child health, like malnutrition in the child. Maternal is the prenatal care, postnatal care, fertility treatment in related to the for the gapping. We have public health education, educating the public for the common diseases, can be for the communicable disorders, for the sanitation, for the proper diet, for the vaccination. Vital statistics. Now each hospital, or how does the government know, like what is the infant mortality rate, what is the maternal mortality rate? This all is a vital statistic. This is compared on a national level with India to the other developed countries or the developing countries. So these are the vital statistics which are captured. For this, even each hospital is supposed to provide this data about the number of the deaths, the number of the birth in every week or in every month to the local municipal authorities. Health planning. Like transformation is there, healthcare is changing, scenario is changing. Now we know the polio is completely eradicated. So do we need to still run the polio eradication program? No. The anti-tuberculosis program, the RNTCPC, which was supposed to be running, which is running, is modified with the stages, because initially the tuberculous bacillus, Mycobacterium tuberculous bacillus, was not resistant to the drug, but now it has developed a resistance. So now it has been revised, and now we have the DOTS therapy or DOTS planning. So this all is health planning, where we are changing the strategy or policy as per the what is the need of the community, how the community is changing. So that is a health planning. Now we are coming from, we don't have a major hold on, we don't have a major problem with the communicable diseases. We are taking very much care of the communicable diseases, but we do have more disease load of the lifestyle diseases. So that is about the health planning. So that's why the diabetes education planning will come into a picture. Then we have a occupational health and reduction of health hazard, which is related to specific occupation, like radiology people are exposed to radiation. It can be the coal mining people having silicosis, asbestosis. These are the occupational related health hazard. So all that is taken care by the occupational health and reduction of health hazard. Then what comes under the private health services? It's a promotion of health. What do you mean by promotion of health? It means you will promote an individual, or you will motivate an individual to be unhealthy, to adopt an healthy living style, eat in a proper doses or in a proper sizes at proper timing, to follow the lifestyle where you have the mild exercises. So that is a promotion of health. Prevention of disease. What you call prevention of disease is that you are taking an extra effort or initiative so that the disease would not occur. There are many ways in prevention of disease. The best way which we know is in vaccination. There are certain vaccines, or 15 vaccines, which has made be compulsory by the government for each child. Besides this mandatory vaccines, there are certain other vaccines which can be taken, and if taken, you can prevent yourself from that particular diseases. So that is a prevention of diseases. For example, even nowadays there is a vaccination to prevent the cervical cancer in women. So that is a prevention of diseases. Early diagnosis and treatment. Here comes what we say the medical equipment, the pillar of the healthcare, where it helps to diagnose properly at proper time. That is the early diagnosis. If the diagnosis is prompt, then the treatment will definitely be successful. So that is early diagnosis and treatment. Rehabilitation. Now what is rehabilitation? Rehabilitation is basically after the major surgery or after certain event, life event, coming back to normal life as much as possible. That is a rehabilitation. Like for example, if the person has gone through the CABG or the bypass surgery, after bypass surgery to certain extent, after 30 days or 60 days, he should be rehabilitated in such a way that he is doing his own jobs as he was doing previous surgery. Here comes the physiotherapy in picture. This plays a major role in also the accidental injuries, trauma injuries, major surgeries. It plays a very important role also in a paralysis or paralysis patient.